This is a video message for two groups of Americans, the tens of thousands, perhaps even millions, caught in the same trap as I am, and the town hallers who, if they get their way, are going to be de facto death panels for citizens like myself. Let me share a little story with you. I'm 55 years old and have been part of the American workforce for 44 years, beginning with my first newspaper delivery route. In high school, I worked in a burger joint and as maintenance man for my local school district. I once spent a summer as a commercial salmon fisherman. I have delivered phone books and laundry, washed dishes, restocked library shelves, and passed petitions. I've paid into Social Security and Medicare for 40 years. I'm currently unemployed, and for all intents and purposes, I am completely disabled. Just like almost every human being on this planet, I've experienced occasional bouts of lower back pain. It comes with the territory. Around the middle of June this year, though, I began having excruciating pain in my lower back that was categorically different than anything I'd ever felt before. In fact, I had pain and numbness all the way to my toes. I went to see my primary health care provider, who happens to be a physician's assistant. He sent me out for x-rays and gave me what turned out to be some fairly useless painkillers. The x-rays showed that I have degenerative disc disease and arthritis in my back. The pain is caused by so-called pinched nerves, with the result that I can't stand even for more than 2 or 3 minutes at a time, which, as you may conclude, it makes it kind of tough to make a pot of coffee, unload a dishwasher, take a shower, or I don't know, even work. Yeah, tough, right? Well, it gets better. The same week my back quit on me, I went to see a dermatologist about a mole that I wanted to have checked out. He only glanced at the mole and then honed in like a laser on a spot on my nose and another on my forehead. He said I should have them both biopsied. Well, it was obvious from his tone of voice and the look on his face that we both knew what was coming, and we were right. I have basal cell carcinoma and 2 different spots on my face that will require plastic surgery to completely take care of it. Because I'm unemployed, I applied for Arizona's version of Medicaid, which is known by the acronym ACCESS, or AHCCCS, I know it's very unwieldy, on June 21st. Here is the letter I received back from them on Saturday, which was August 15th, denying my application because I make too much money. Let me tell you how much money is too much money in Arizona to qualify for Medicaid. I get $259 a week in unemployment benefits. Of that $259, $100 is automatically deducted for child support, leaving me $159 a week for rent, utilities, food, clothing, transportation, medical, dental, vision, children's birthdays, Christmas gifts, and of course my boat payments. Only kidding about the boat payments, of course. As if. I have already paid out of my pocket more than $700 since June for x-rays, doctor's visits, and medication. All of those prices heavily discounted because I am a so-called self-payer. Why the discounts? Because the entire system is corrupt. There is so much overcharging when insurance pays the bills that the price of health care in this country could be cut in half without affecting anyone's bottom line but the pharmaceutical and insurance industries. Now, I don't begrudge insurance companies the right to make a profit. They have a place in our system, and I wish them great luck in providing life insurance, car insurance, property insurance, anything else they want except to cover health insurance. They have no place in the health industry. Health insurance is the biggest fraud perpetrated on a gullible public in the history of this country. So as I sit here speaking to you, cancer is eating my face, and overuse of my back and bad genes are eating away at my spine. If you don't think this could happen to you or to a family member or to a friend, get a grip, because you're kidding yourself. So for the multitude of Americans who share my situation, I will begin a hunger strike as soon as the gavel falls to convene the second session of the 111th Congress, and I will continue it until all 47 million of us, the uninsured, are able to obtain health care without having to camp out overnight to get a spot at a roving clinic or sit for hours in an emergency room, all the while avoiding eye contact because we are being shamed for being poor. In order to accomplish this, ironically, I am asking for medical advice on conducting my hunger strike. Any physician who with expertise in this area who shares my concerns, please contact me at dmarkanderson@gmail.com, and I will put up that address at the end of this video. Excuse me. I also would like to hear from anyone else who wants to contact me for any other reason as well. Just shoot me an email at the same address, and I will do my utmost to reply to you. Thank you for watching, and to all my friends and family, keep your heads up, and I love you. Thank you.